In this video, I'll tell you the detailed syllabus of pharmacology from the CCMP perspective and the exam pattern also. Let's dive right in. Hey, this is Dr. Avinash. I am the medical coaching expert and I'm on a mission to help a million medicos clear their basics, upgrade their knowledge and excel in their clinical practice. This video is going to be for the CCMP enrolled homeopathy practitioners. By the end of this video, you will know the detailed syllabus of pharmacology and the exam pattern and what you need to do to clear your exams with excellent marks. The Maharashtra University of Health Sciences expects the CCMP practitioners to have the following knowledge base and the following set of skills. As far as knowledge is concerned, the university expects you to have the following knowledge so that you can practice pharmacology in a better manner. 1. You need to know the mechanism of action and the uses of all the drugs given in our standard textbook. Second, you need to know the indications, the contraindications and the adverse effects or adverse drug reactions of these medicines. Third, you also must be aware of the fact that same medicine cannot be given to all the people. There are certain special circumstances where your therapy changes, your medicines change. These include elderly patients, pregnant women, patients with heart failure, patients with renal failure, patients with hepatic failure, and so on and so forth. So the university is very clear. You need to know the pharmacology in special circumstances. And lastly, you should be aware of a concept called as the essential drug list. Then the university also expects you to have the following set of skills. This includes giving a correct prescription in a proper order. Second, if a patient walks into your clinic, you should be able to identify the adverse drug reactions of any medication just by looking at it or just by taking a good history about it. Third, you should be able to do pre and post prescription counseling. It is a very well known phenomena that 50% patients get the wrong medicines and people who get the right medicines, out of them only 50% actually complete the course of medication. Pre and post prescription counseling includes explaining to the patient why the medicines that you're giving is important and why he or she needs to complete that prescription. You also must be able to explain to the patient what are the adverse reactions that they should notify you about and what is supposed to be done about it. So all these things would be included under this topic called as skills that the university expects you to know. Now, keeping this knowledge and skills in mind, let us explore the syllabus of pharmacology. The entire pharmacology syllabus can be divided into 12 main categories. Let me help you out with every single one of them and I will give you some examples from each of this category so you know what is expected. The first category is general pharmacology. Here you need to understand pharmacokinetics, pharmacodynamics. Pharmacokinetics is what the body does to the medication, to the drug. Pharmacodynamics is what the drug does to the human body. You need to understand the various routes of drug administration, their advantages, their disadvantages. You need to know what are the different types of adverse drug reactions or adverse drug effects. Plus, you should also have a good understanding of when is it correct or rational to combine two medicines together and when it is irrational to combine medicines together. So drug combinations should be understood very clearly when we are understanding general pharmacology. The second unit is pharmacology of autonomic nervous system. Here the university expects you to know the adrenergic and the cholinergic nervous system, which means sympathetic and parasympathetic nervous system. You need to have a good understanding of the adrenergic and cholinergic receptors The adrenergic receptors will be alpha and beta receptors. The cholinergic receptors are nicotinic and muscarinic receptors, pardon me. And keeping all these things in mind, you should be able to talk about medicines which will activate those receptors. They are called as agonists, and medicines that will inhibit those receptors, they are called as antagonists. So cholinergic agonist and antagonist, similarly adrenergic agonist and antagonist should be clear in your mind. The third category or the third section we are going to deal with is pharmacology of kidneys and cardiovascular system. Here you need to understand diuretics, medicines to be given in case of myocardial infarction or angina, in cases of hypertension and for heart failure. Okay, we'll be talking about furosemide and thiazide category of diuretics. We'll be talking about digoxin. We'll be talking about nitroglycerin. We'll be talking about all the calcium channel blockers in this particular category. Very, very important section, must know. The fourth section that you have to know is blood pharmacology. In this category, you are expected to know all the medications that act on blood coagulation system. This will include antiplatelets, anti-clotting factors, pro-clotting factors, pro-platelet medications. So all of them would be included in this unit. You also need to know medicines that can lower the level of lipids and cholesterol. So you will have a separate chapter on hypolipidemic drugs. Plus, you also need to know medicines that can be given to increase the hemoglobin level of the patient, which will include iron, vitamin B12 and folate. These three topics would be included under a section called as Hematinics. The next and probably one of the biggest section is going to be pharmacology of CNS, the central nervous system. Now, many of these medications you might not be allowed to use in your clinical practice, but you need to monitor many of these medications in your patients. These will include sedatives and hypnotics for people who are finding it difficult to fall asleep, anti-epileptic as a medication for epilepsy, anti-Parkinson's, antidepressants, antipsychotics, anti-mania. These three medications, usage of these three medications is on the rise thanks to all the events that are happening in the world today. Anxiolytics, people who suffer from anxiety might be taking these medications, so you might have to monitor them. Including in this category are non-steroidal anti-inflammatory drugs, which includes ibuprofen, naproxen, aspirin, paracetamol. These ones you need to know in detail the treatment of migraine, which is kind of a common kind of a headache that you find in your clinical practice. You need to know how to manage addictions, smoking, tobacco smoking and alcohol and other kind of drug addictions. Plus a little bit about local anesthetics should be clear in your mind. Then comes the section on drug for allergies, coughs and vaccines. See, you need to know all the vaccines that are approved under the National Immunization Program. Not only that, you also need to know additional vaccines that have been approved by the Indian Academy of Pediatricians. You should know drugs for cough, when to treat a cough and when not to treat a cough is also an important concept you will be learning in this particular unit. Plus, you should know how to manage a case of bronchial asthma in details. Moving on, we will be talking about chemotherapy. This section is one of the most important sections from pharmacology. Here, all antimicrobials are included, including penicillin, cephalosporin, tetracycline, chloramphenicol, aminoglycosides, sulfonamides, cotrimoxazole, antifungal, antivirals, and helminths. All of this, antimalarials, all of this would be included in chemotherapy. Very important section. The next unit is pharmacology of endocrine system. Here, the number one topic that you should be absolutely aware of is, of course, anti-diabetic medication. But apart from that, corticosteroids, androgens, estrogens, progesterone, they're antagonists, so that you can explain to your patient about oral contraceptive pills is very, very important. Now, you should also understand the medicines that are acting on the thyroid gland also. The next section is going to be gastrointestinal tract pharmacology. Here you need to have medicines working on peptic ulcers, which will include proton pump inhibitors, we will have H2 receptor blockers, and so on. Antacids would be included in this topic. We'll be talking about antiemetics, medicines that will stop vomiting, and medicines for diarrhea and constipation. The next unit is perioperative management. You need to have a little bit of understanding about antiseptics, local anesthetics, drugs used in the immediate post-operative period, just because you might have to use this knowledge in the immediate post-operative period. The 11th important unit will group it together as a miscellaneous topic, and here you need to understand the drug interactions. You need to understand poisoning, including snake bites and scorpion bites, okay, or scorpion stings to be more precise, and medicines that work on eyes, that's ocular pharmacology, and skin pharmacology. So you need to know all of this. And last but not the least, there's something called as rational pharmacotherapy, where you need to understand the P-drug concept, or the personal drug concept, where you will be taught how to create your own set of personal drugs that you can keep in your clinic. You need to understand in detail the prescription writing. You need to understand the essential drug list, the fixed drug combination, and of course a little bit about vitamins, antioxidants, and many other such things. So that completes your syllabus for pharmacology from CCMP perspective. This is a good time to talk about the exam. Okay, now there will be a theory exam and there will be a practical exam. I am more interested in helping you out with the theory exam pattern here. The question paper would be under the heading CCMP question paper 1. That's your examination number 1. Just one entire exam dedicated only to pharmacology. This exam would be of 3 hours duration, and the maximum marks is 50. The minimum marks required for passing is going to be 25. So 50% marks are required to clear your exam. The exam pattern would be 20 MCQs, each MCQ for half mark. So multiple choice questions, half mark each, 20 MCQs, that's 10 marks. Then you will have a long answer question. You will be given 3 questions. You need to answer any 2 of them. Each long answer would be for 7.5 marks. That makes it 15 marks. So 25 marks are over here. Then comes short answer questions or SAQs. 4 questions, you need to attempt any 3 of them. Each SAQ is for 5 marks. So that makes 15 marks more. And lastly, there are answer in brief question. 6 questions, you need to answer any 5 of them, and these questions are for 2 marks each. So that's total of 10 marks, and that's how your exam paper pattern would be. Now this is paper 1. There's also a paper 2. We also have to understand the syllabus from medicine, surgery, obstetrics, gynecology, pediatrics, and PSM, but that is a topic of discussion for some other video. I hope you found value in today's video. If yes, please give this video a thumbs up, share it with your colleagues so they also know what they have to understand, what they have to explore in pharmacology. I will see you in my next video where I explain to you the other subjects syllabus. Till then, take care, keep rocking, bye bye.